wanted to make a nice little compilation of a lot of different methods you can utilize to provide external tactile feedback cues to your hip hinge. Right here, starting out, we're in a tall kneel position, and we're utilizing that super band for that pattern assistance to just give us a nice little pull posteriorly to help us shift and bring that weight back, and to only hinge at the hips, not roll at the lower back or anywhere up the spine. Right here, the exact same concept. All we're really trying to do is move it into a standing position, where we have to consider more than just the hip joint. In the first one, we take out the knees and the ankles, and we can just focus purely on the hips. In this one, throw those knees and ankles in, and we have to really learn to then not borrow any movement from those joints below the hips in the knees and the ankles. And so along with that, the band is there to provide that nice little pull to help keep you pulled back, shift your weight posteriorly to really truly feel it in the glutes and the hamstrings, and get that posterior chain lit up and really feel it where you're supposed to feel it. And so great way to feel that proper movement by utilizing that super band to pull you back. Right here, again, all we're doing is we're stacking another piece of tactile feedback on with the med ball hug. And what that allows us to do is a couple of things. Not only does it balance us out a little bit, but once we have the posterior weight shift down, but it also allows, if we give it a good squeeze, to really create some good intra-abdominal pressure. Sometimes when we do the hip hinge, we get a little bit of low back pain or a sharp pain in the low back, and that med ball squeeze really allows us to, I would say, create the intra-abdominal pressure, breathe a little bit more proper, and to help to alleviate any low back pain that may inhibit our hip hinge pattern. Right here, switching up the band, we're changing that, we're moving it towards the front for those people who have difficulty maybe going down a little bit further, and we're placing the band towards the front of the legs. This one right here is a little different. We're placing it right behind the knees with the goal of, some people a lot of times want to utilize the knees and bend almost like a squat. This is a great way as they're pushing back to keep that knee more extended or straightened. And so really in that one, we're just feeding the dysfunction, and we're allowing somebody to push against the band to avoid flexing the knees. Right here, we're utilizing a foam roll right between the legs there, giving it a good squeeze to engage those hip adductors, which connect onto right there at the bottom of the pelvis. And so a great way to utilize the pelvic floor muscles appropriately, create good intra-abdominal pressure, get that core where we want it, and also that one helps alleviate low back pain. This kettlebell handcuff position is a great position to, if you don't have a super band, to help coax you to push the weight back, get a nice posterior weight shift, and move in that horizontal plane where we're pushing the butt back. And we're not going up and down, but we're moving in more of a front to back horizontal motion. I love this one right here. This is a great way, this hip hinge progression. If you're struggling on your toe touch test, as you go down to touch the toes and you're like, man, don't have any mobility, I don't have any motor control with my pelvis, whatever it may be, this is a great way to give yourself quick and efficient, hamstring mobility. And so, as you can see right there, we're putting the hamstrings on a slack by propping the heels up onto that plate. And then what that allows us to do is to, shift our weight more forward as well, but it puts the hamstring on slack. Right here, we're doing the exact opposite. We're putting them on a stretch, and by putting the toes up on the plate, making it a lot more difficult to go down. But what it's also doing is shifting our weight posteriorly, and it's giving us that feel, our nervous system, that feel of what it should be like. And so this last one here, then we just go to the flat ground, get the plate out of the way. We're not biasing the hammies in a stretch or slack, and we just then allow that kettlebell to just really bring us down a little bit further, maintaining proper form, that is. And so what I usually typically tell people to do is really, as you get to the bottom there, kind of let that marinate a little bit and just kind of pull and rep a few of those out. And I usually do 3 sets of 5 to 8, anywhere in that ballpark, but it really helps. And it'll last for a good 30-40 minutes, so as long as you need a deadlift or get some of those lift ins that require a hip hinge, it's great to do. Right here is the classic utilizing that stick mobility, orange stick right on the back, to making sure the top of it's touching the bump in the back of my head, the middle of it's touching my spine on the middle of my back and the thoracic spine, and then the bottom is right at the top of the sacrum, and just keeping that back as straight as possible. This one right here is a great one for a couple things, but mainly connecting lower and upper body, preventing a pelvic roll to that single leg that's planted into the ground, and also really keeping, again, just everything in sync. And so awesome easy way to do that. The foam roll is probably the most simple way. If you're a beginner, this is one of the best external feedback methods to really create or fix those problems and create a good single leg hip hinge. This one right here, the Superman, does essentially the same thing. Our goal is to try and keep the upper and lower body connected. I feel like even though the foam roll does this, I feel like the Superman's a little bit better at it, but that is to make sure that when I say connected, we don't want that upper body to drop faster and lower than the lower body, and so we want to make sure that they are in sync and that everything's staying flat and streamlined and it's moving, at the same rate, so that upper body is not dropping any faster than the lower body. Superband provides the other feedback methods that or benefits that the foam roll does with the pelvic roll and connecting upper and lower body. Just not quite as good in my opinion, and so if you're a little more advanced, the Superband is probably a little better, or if you just have a Superband on a foam roll. Right here, the kettlebell on the right side here, left leg planted, whatever side is opposite to the leg that's planted, it's a great way to help shift that weight over to that side and keep that pelvis from rolling over to the weighted side. So a great little feedback technique.